With Everyone's Laredo, I'm Mildred.
I'm Karen.
And I'm Victoria.
And we are here with the fire department with the EMS unit, and we're learning how to do IVs, drill, and deliver babies.
Yeah.
So this is very important for us to, just for us to be engaged and just to know the basics of what the EMS department does. And they're actually training and conducting classes right now. So we're gonna go ahead and take a sneak peek and see what this is all about. I'm very interested.
I know, I'm excited. I want to like poke somebody. So.
She wants to bully Anna.
I know, she wants to do an IV on me.
So we're gonna go check it out and see what this is all about.
Let's go.
Let's go see.
That's our man right there, Mr. Martinez. How are you?
Good.
Mildred with Everyone's Laredo.
Hi, how are you, Mark?
Victoria.
And Karen.
So can you tell us a little bit of what to expect today?
Not really. No, I'm just kidding. Yeah, today we're just going to give you a real quick, just a familiarization of some of the mainstays that we actually do with these patients. I believe you guys were asking for IV, and we're going to learn how to do that. There are going to be IO insertions as well, where we're actually drill the needle into the bone. That's in case we can't get an IV access on a patient. That's our plan B. It's just as effective as IV, but we have criteria that we use it from, why we use it and stuff, so we'll discuss that as well. So right now I'm going to take you over to the IO station. What we're doing today is we're doing like a skills day with all the paramedic students. Every time a student learns a specific skill, they actually have to go into the lab, they have to practice it, they have to show proficiency in it. Once they do that and we sign off on them, they can go out in the field and actually practice. So it's actually a three-step process. It's theory class, they learn in the class and they apply it in the lab. Then they go out into the field and apply what they learn in the field, and then they'll take a national registry exam. At the end, they have to pass all those three things in order for them to actually go out and get hired and practice what we practice out in the field. They're on their own. They got their wings and they fly.
Let's go.
All right. Well, wherever we're going to inject anything of any sort, whether it be IV or an intramuscular injection or anything like that, we got to make sure that the site is clean. So we do that with alcohol pads. So you're going to see this a lot. So the guys will tear this open, have access to alcohol pads. Are you allergic to alcohol? No. Awesome. So what we'll do is we'll clean the
People
site.
are allergic to alcohol? What?
I wasn't yesterday.
Poor thing.
So like say I wanted to actually start this, so I would start cleaning here and then circular motion and work my way out. For 5 points, anybody know why?
No.
Well, because if I were to push back and forth, what am I doing with the bacteria? I'm just pushing back and forth. And if you do a circular motion, you work your way out, you're pushing it out.
Okay.
So you're trying to keep that site as aseptic as possible. So once you do that, you got to have an alcohol or some cleaning agent available. Usually alcohol is the preferred cleaning agent of choice. You pull that out. So you clean the site. Another thing you need to have is, like I said, your catheter. You need to have your IV solution. We're gonna, and that's back there. The reason we use this is because the body's gonna most likely adapt to this fluid over all the other fluids that are available. So this is why we use sodium chloride. It's just how fast the body can absorb it and utilize it. So we have our bag, so we call a spike in the bag. So when we have this bag, this also comes in kind of like the catheter comes in a sealed bag. So we're gonna look at the bag. It's got expiration dates and stuff as well. As you can see here, it expires of March of 2015. So the expiration date meets the criteria. We look at it, make sure it's clear. If there's any cloudy material or anything in there, that bag is not usable, that fluid. So make sure it is clear. Once it's clear and stuff, we're gonna make sure that these ports are sealed. And if they are, that's also a check. So we move on to the next step. So we know the bag is good. This is a fluid that's actually gonna be being given to you through the IV. And this is a tubing that we need in order to push the fluid into you. So you can see, we call it spike in the bag. This right here is just a locking mechanism. It's gonna pinch the line shut. The reason we call it spike in the bag is that's just what it is. It's a spike. We're actually gonna puncture it, hence the spiking, as far as we can.
Okay.
So then you're gonna pick it up, you're gonna rehang it, and then, yeah, we're gonna, this right here is called a chamber, and what that does is, this is what's gonna regulate the flow. It's gonna help us, and again, it all works on gravity. So we do it one squeeze, and it fills, you wanna fill it up about halfway. So you just kind of unroll this and do it as slow as you possibly can. It's going to start to flow fluid. And you can see it, there it comes. Now you see the bubbles?
Mm-hmm.
Those are bad for the body. There are no bubbles in the body. So you can see there they go. The slower you do it, the less bubbles you create. If you do it real fast, there's more bubbles that come in. So, no bubbles. So this is ready to go. Notice how I never touch this and stuff like that. Why? Because this is actually what I'm trying to keep this as germ-free as I possibly can. We're going to make sure that we're using our catheters. Now, each catheter, you see there's a different number on it.
Mm-hmm.
The bigger the number, the thinner it is and shorter, right? So, as you can see, 20 and a 22. And if I tell you I want a bigger needle, what number would you give me?
20.
Awesome. That you need to dispose of the needle that you just used properly.
Yeah, I imagine.
There's a needle in there and there's blood in there. Now we all know there's a lot of infectious diseases out there. So this is called a sharps container. Every single needle that you use, regardless of whether you were successful or not, needs to go in the sharps container. And that's where it goes.
Okay.
Once you put it in there, there's absolutely no chance that you can get poked. What I mean by poked is you'll put a needle aside, because there's been a lot of habits of people will start an IV and they'll put it on the floor, put it on the side. So here I come and try and help you. It's like, yeah, let me help you with this patient. And then, oh, what's this? So that's the last thing we want.
That's the worst feeling in the world.
Okay, so I know you did mention you have events and programs and where you teach the community about CPR or what have you. Can you tell me a little bit more about that?
Yeah, we actually do collaborate with a lot of different entities. One of our bigger entities that we collaborate with is the health department. Ms. Nora Martinez is one of the persons that spearheads the event, like a mass CPR course that they give. It's actually a free CPR course to the community. Although it isn't a full-fledged certification course, it's more of like an awareness course. But it's offered maybe once a year, I believe. And the last time that we had an event like that, we had over about 700 or 800 students show up from the school districts. But it's important that the community recognize that they need our services, and the sooner they recognize that, the sooner they call us, the sooner we can get there. And it's just a win-win situation for everybody.
And like to get certified for CPR, like can you?
An actual certification course requires you to be sitting in class, and the most basic course, which is a heart saver, usually it's anywhere from 4 to 6 hours. It all depends on the learning style of the student.
Okay.
Some people learn really quick, some people learn a little bit slower. What I mean by that is they like to ask a lot of questions and stuff like that. It's a hands-on course, so depending on the amount of students you have as well, the most basic course of heart saver is about 4 to 6 hours, and then you have the healthcare provider, which is more for healthcare providers, which is nurses, doctors, paramedics, and such, doctors' offices. That's got to be an 8-hour course, and that teaches more advanced techniques like airway management. It focuses more on defibrillation and stuff like that with the ADUs and all that other stuff. But even if you don't get certified, if you take an awareness course, it's still a step up from not taking a course at all.
Yeah.
So if you know at least the basic steps, that's just going to help out the patient.
I've never been in an ambulance.
Neither have I.
There's a lot going on.
We are here in a simulation. We're going to do some IV stuff, and I think Victoria's going to do it.
I'm gonna do it on your arm.
She wants to poke at
Likes to
us.
play with. Yes, we need to find a vein, a big juicy vein, to gain IV access.
Okay, so we're gonna do it. You go.
I'm gonna do it. Do I need the little thingy? Yes, right?
Wear your gloves.
Oh, I need gloves. Yes.
Need gloves.
This is a real thing.
Look, I'm going to it'll just die and then your screws bite.
I was like, hey, wait a minute. Okay, so first we need to put on the huge gloves. Okay, I know there's no woman in the fire department.
You guys have to have small hands too.
No.
So I need to find that juicy vein, right?
Uh-huh.
Okay, we'll just pretend. Do you have to do it fast?
Is there a time limit?
Yeah.
You know, or
There is, depending on the urgency of the patient. If you have a patient that requires a rapid transport, then yeah, we want to keep the time to about 10 minutes
oh, okay.
on scene, which means, like, for instance, a big trauma, a big car accident, or shooting, a stabbing, or anything like that, where we say, you know what, this patient really needs to move to the hospital. We try and limit the on-scene time to 10 minutes.
Oh, okay.
So it's all about
45 degrees.
So you want to have real good, grab it, make sure you don't hit that white button, because as soon as you do that, you're going to retract that needle. So.
Ow! Stop!
Remember we were talking about the flash?
Yes.
So there you're good. You're inside the vein. So now what you want to do is, because you're in the vein, you want to hold the catheter a little bit with one hand, and then pull the needle back just a little bit, right there. Now
Push it.
drop it. Now you want to just grab this and push it all the way in.
Hold on. I'm gonna fix my.
And it's hard when you have these big size gloves.
There.
Good. You're gonna take the tourniquet off, and you would put pressure on the vein. Remember?
Okay.
Put pressure on the vein as hard as you can. Well, not, but now you're gonna hit that white button. Track that needle. You see what I mean by you gotta put pressure, a lot of pressure. And that's normal for a patient.
Okay.
Because remember we said it's under constant pressure. So get rid of that. And then I would give you this. You would take that cap off. Remember, I have gloves on as well, right?
Can I throw it away?
Absolutely. So this would go in there. Push it in just a little bit. Now you can let go of here, grab the catheter, whatever, and then screw it in.
Oh.
It's
I think my patient would have died already.
righty
I
tighty.
would
lefty,
not
there you
want
go.
her to do that on me.
This patient's ready to go.
I didn't kill him.
Not,
He's
not
probably in pain,
with
though.
heavy, but painful, yeah, no. But as you can see, it's a skill that you need to practice. I don't think that the lab is sufficient, so what we do with our students is we send them out to the field. So a lot of patients will ask, why do I need an IV? And it's like, it builds confidence in the student to be able to do IVs, and it also builds confidence in the patients to say, oh, the guy was pretty quick and it was not as painful as I thought, and so forth. But it is a skill we need to practice, because obviously if you don't practice it, you're going to get really rusty, and the shakies and all that stuff start to kick in.
It's super rough.
It
How
is.
long do your trainees stay on this unit, like learning?
The whole paramedic course in its entirety is 8 months, but before they become paramedics, they have to become EMT basics, emergency medical technicians. That's a 2.5 month course. So in its entirety, the whole program in itself, you're looking at about a year. That's from EMT basic, then they transition over to the paramedic side, and then the paramedic is what teaches them the advanced life-saving techniques. So in its entirety, you're looking at about a year's worth of training. But they do ambulance runs starting with EMT basic. They learn how to do patient assessments, how to take blood pressures and temperatures and so forth, how to talk to patients, and then eventually move on to the more invasive stuff like IVs, and then eventually move on to way more invasive stuff like IO, the drilling, the looking at the cardiac monitors, defibrillation, and all that stuff. Learning how to use the meds, what meds to use, how much med to use, what type of patient, the different types of patients we have. We can and cannot use this med, and so forth like that.
Nice.
So
How
this
did you
patient's
feel?
good to go.
I think I can go on the field now. I don't know.
Awesome. As what?
I would cheer if
Yeah, exactly.
I'm sitting up here, I think
I would cheer them on.
You did,
I'll
you did
try.
really well. You did really well.
I'll hang over the IV.
You did really good. I mean, you got it on the first try. It's just one of those techniques that some people take a while to get, and some people just becomes their niche.
You're a natural, Victoria.
She's one step closer. So, good job.
Awesome.
A pro at this now, so you're gonna see me.
Out and about, streets of Laredo. If I get hurt and I see her, I'm gonna run the other way.
What do you mean? I was good.
You were good and you didn't get blood on you,
No.
so
That's a plus.
very neat.
Yeah.
So now when that's not possible, they go to the next step, which is the drilling to the bone to get that in there. So we're gonna go ahead and
Try that one.
Now I wanna do that one. Here's Martinez.
Once we attempted to try the IV,
Twice.
and through our protocols twice, and we were unsuccessful, well then we're going to jump into a more advanced technique, what they call the intraosseous. It's just as effective as the IV. So what we're doing is we're drilling into the matrix of the bone, which is bone marrow, and we're going to give, once we secure that, we're sure that we actually got a good IO insertion, well then we can give our meds through there, and it would be just as effective as an IV. which is why it's an approved method also to use.
Wouldn't it
Is
work,
this
like,
one more
faster?
painful?
Is it more painful? But we have criteria with us. We only use it for patients that are unconscious
Oh,
or
okay.
that are in cardiac arrest.
Okay.
Now, there's some other entities that use it on live patients that are awake and conscious and stuff.
That would hurt.
Through the teachings and stuff that they use, most of the people that has been used on conscious patients, they'll usually describe it as a pain maybe like a 3 or 4 out of 10. There's actually YouTube videos out there that actually show you that they're actually doing a live IO insertion, and the patient's awake and they're like, well, you know what, it was a little pinch, but I'm okay.
Okay.
So as far as the pain scale, most people say it's a 3 or 4. Again, I've never had it done on myself, and I don't plan to any in the future. Right? So, but
No,
I'm
we
just
wouldn't know.
I'm gonna take their word for it.
Yeah.
But they most of the people said it is a 3 or 4 out of a 10, so which isn't bad. I mean,
Are we filming it?
Yeah, we're filming.
absolutely.
Yeah.
Yes,
So this
I get
is,
to deliver a baby.
Instructor Levi, he's also a registered nurse as well. If anybody's proficient in this skill, it's him. He's going to teach you our plan B. I taught you the IV part where, you know, that is our mainstay. We always try and get an IV on a patient if we feel like they need it. But sometimes we do run into situations where, you know what, that's just, we can't get IV access either because of something the patient's presented with, or just for whatever reason we can't get IV access. This is our plan B.
So like Mr. Martinez said, this is our plan B. Anytime that we can't obtain any IV access on any kind of patient, we will go to the IO. Now, of course, this is only used as a last resort, given that we need life-saving medications. In most cases, it will usually be a person who overdosed on IV drugs, like heroin or stuff like that, where their veins are shot, so they don't have any more IV access or anything like that, so we'll go and we'll drill into the hole. There's several sites that you can use. You can use the tibia for pediatric patients. You can use the humerus, okay, on adult patients. This would be the shoulder, all right? This would be the tibia in an adult patient, all right? You could also use the hip. So most of the time what you need for this particular intervention would be your drill. Okay,
That's what
That
the
looks
drill
like,
looks like.
I thought it was a glue gun.
No, it does look like a glue gun right now. It's a drill, okay? So this is your drill. You need your different sized needles, all right? And the needle's composed of a stylet,
Bless you.
Thank you.
okay? Which is a stylet. And then this is what stays inside the bone. Now, unlike the IV, this is real metal, okay? So if you see how it's grooved and it's molded so that it can drill,
Okay.
okay? You see how?
Oh wow, that
So this is
does
like-
look painful.
Yeah. It's like a nail, basically, right? So depending on what site you're going to use, or the size of the patient, or whether the patient's a pediatric or an adult, you're going to use the appropriate size needles, right? All right. So you want to look for the flat part of the bone.
Okay.
Okay. You know how you have your shin, and you have the pointy edge, and then to the side of it would be the flat part of your bone, right? So that's what you want to use to be able to do it. So what you do is you want to stabilize the patient. Again, this is an unconscious patient who needs life-saving medication and does not have any IV access. You choose your appropriate size needle. Like in this case, I would use this one.
Okay.
All right. So you want to take off the protective cover, insert your needle into your drill, take this off. Now what you want to do is you're going to stabilize the bone. You want to go in, and then you're going to drill. Okay, and you're going to stop once you feel less resistance. So you can do drill, and then we're in. Okay. So after you're in, then you remove the stylet. Take it out. Dispose of it in a sharps container, right? We're training right now, so we don't throw it away. You want to spike your bag, like we did on the other one. You hang it up. Inflate your bag to 300 millimeters of mercury. Okay. Have it ready. After you have the access, you're going to secure it. You're going to get your syringe. And in an adult, you're going to flush it with 10 cc's. Okay? Now you can go. Apply it there the same way you did. Okay? You want to make sure you're in, so you want to aspirate a little bit. Make sure you're in the bone. You might have some bone marrow come out. Okay? When you flush, what you're doing is you're going to create a pocket within the bone to break that. It's like spongy bone that's inside. Alright? So, and at the same time, you're looking to see if there's any swelling or anything behind your access. Alright? That meaning that you would have infiltrated the bone. So once you infuse it, you know you're in, you remove it, and then after that you connect your bag.
Okay.
Take the protective cover out.
So we're gonna take this out and we're gonna use this one, right?
Yes.
And then we're gonna twist this off.
No.
Oops, I already started off wrong.
Twist that back on, okay?
Twist it back
You want
on.
to put it on the drill, yes.
Okay.
Of course, by this point you already identified your landmark. You're going to use the tibia, right? Are you going to use what side of the bone?
This right here.
The flat side of the bone, right? Which would be this
Just because
one.
it's already poked. Everything I knew. I'm just kidding. Okay, so the flat side over there.
Uh-huh.
Okay, so now I'm just gonna.
No.
Oh,
Take off your protective cover.
leave me alone. Okay, delete that. It's out. Okay, so now I have this.
You want to stabilize your bone.
Okay. Go in there.
Go in. Once you feel the resistance from the
I'm
bone,
gonna
then you drill and go all the way in.
Okay, so I feel the resistance and now I'm gonna drop.
All the way.
Yeah, power.
Then take it out. And now we're going to remove the part you removed at the beginning.
Okay, I got excited. Got a couple of steps ahead. Okay, so we take this out, and of course we put that in there, but for purposes of training,
We save it.
we save it.
Now we're going to use 10 mLs of fluid to flush.
Yes. So, cap off. Screw this in there. Is that bad that this other one moved?
No, okay.
Nice. I'm careful.
Good job.
Okay, you didn't see any swelling or anything behind the leg.
Everything's good. 10 points. And then
You remove your syringe. And then you're going to connect the tubing that you have connected to your
Okay.
bag. Yeah.
well, thank you so much. That was interesting. I mean, obviously there's a lot of steps to the process. It's not as easy as it looks.
No.
So you have to be very careful, very skilled, practice, 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 so you can get it right.
Yes.
Obviously. So we just left the fire department building, and let me tell you, we learned a ton of stuff.
Yes. Did you like yours poking a hole in a bone?
Drilling, yes.
Drilling. Poking.
I know. And
She did the poking.
Yeah, I did the poking. Yeah. So.
And I had a lot of fun.
You're watching us.
She's the administrator. She looks and she pinpoints what we did
I
wrong.
know, yeah. Like I said, I would be the driver. I would make sure to get you onto safety, just to give me the wheels. No, but I mean, we learned that it takes a lot of hard work to be in the EMS and to be a firefighter.
It takes dedication and practice. It's not
Lots of
something.
practice, about a year of practice, and they do so much for our communities. They're the first responders on scene, and if it weren't for them, we probably wouldn't even make it to the hospital.
Exactly. So we are very thankful for their services. It requires a lot of passion for this, and they certainly do have it. So
Very kind to us too.
yes, they were.
So we had a great day, and now we're on to our next adventure.
So.
This is everyone's Laredo. We'll see you next time.
City, my city, my city, your city, my city, your city, my city, your city, my city. This has been an EMS public service announcement. Keep it safe in our city.